Types of hyperkinetic movement disorders. The first one is tremors. Tremors are rhythmic contraction of a muscle group, that is, alternating contractions of the agonist and the antagonist muscles occur in an oscillating manner. Types of tremors. We have resting tremors, essential tremors, intentional tremors due to cerebellar disease, physiological tremors, which are mild, high frequency tremors with no clinical consequence, enhanced physiological tremors, which are associated with anxiety, fatigue, drugs, and other metabolic disorders. These are postural tremors, which mostly affects the upper limbs, occurs bilaterally and symmetrical in nature. Then we have Parkinson's tremors, which affects the chin, tongue, hands, and the legs. The exact cause is not known. It is associated with the LINGO1 gene. Aggravating factors is stress. Treatment includes beta blockers, propranolol, primidone, initial low dose, and then gradually increase. The second type of hyperkinetic movement disorder is dystonia. Dystonia are sustained patterned contractions of the agonist or the antagonist with twisting movements and abnormal posture. Dystonia is classified based on age, distribution, and etiology. Based on age, we have childhood and adulthood dystonia. Based on distribution, we have focal, multifocal, segmental, and generalized dystonia. Based on etiology, we have primary and secondary dystonia. Under secondary dystonia, we have dopamine responsive dystonia and drug induced dystonia. Etiology is due to mutation in the DYT gene. Under focal dystonias, we have blepharospasm. These are dystonic contractions of the eyelids with increased blinking that interferes with reading and writing. Then we have oromandibular dystonia, which are contractions of muscles of the lips, tongue, and jaw. Spasmodic dystonia, which are dystonic contractions of the vocal cords, which results in impaired speech. Cervical dystonia. Under this we have enterocollis is when the head is deviated anteriorly, retrocollis when the head is deviated posteriorly, and torticollis when the head is deviated laterally. Limb dystonia is seen in arms and legs. Oromandibular dystonia and cervical dystonia both combine to form the Midge syndrome. Primary dystonia, the onset is childhood. Secondary dystonia occurs due to consequence of drugs or neurological conditions. Dystonia plus syndrome is when the dystonia occurs as a part of neurodegenerative disorders, for example, Wilson's disease. Treatment includes levodopa for primary dystonia, anticholinergics, baclofen, and Botox. Etiology is due to increased number of polyglutamine in the coding sequence, mostly seen in males. Types of chorea: HDL1, which is a personality disorder, HDL2, which is a movement disorder, chorea gravidarum, seen during pregnancy. Clinical features includes darting type of tongue, restricted to face or generalized. Precipitating factors include oral contraceptive pills. Then we have chorea acanthosis, which is chorea along with RBC abnormality, may also include hypo or hyperglycemia. Then we have Sydenham's chorea, which is seen in children. It is also called as the Saint Vitus dance. Clinical features includes inability of sustained eye closure, tongue protrusion. Milkmaid sign is milking action of fingers when asked to grasp the physician's finger. Then we have senile chorea, which is seen in middle age group. Other features include behavioral changes, pathology of chorea, progressive atrophy of caudate nuclei, which results in diffuse cortical atrophy in the later stages. Therefore, it decreases the metabolic activity of the caudate nucleus and the putamen. Treatment includes neuroleptics, baclofen, and dopamine blocking agents. Athetosis. These are slow, involuntary breathing movements affecting the arms and hands. Then we have hemiballismus. It is a type of chorea composed of wild flinging, large amplitude movements of one side of the body. Proximal limbs are more affected. The movements are so severe that it results in exhaustion, dehydration, injury, and death, but resolves spontaneously after weeks or months. Treatment for hemiballismus includes dopamine blocking drugs. Paroxysmal dyskinesia is a group of rare disorders that includes chorea, dystonia, and ballismus. Here, chorea is precipitated on sudden movements or running. It affects one side of the body, lasts for a few seconds to minutes, reoccurs several times a day. Precipitating factors are alcohol, caffeine, stress, fatigue. Treatment includes anticonvulsant therapy. Then we have tics or Tourette syndrome. These are brief, repetitive, stereotypical muscle contractions that are often suppressible. Etiology is due to genetic disorder. Clinical features, we have motor tics, for example, blinking or twitching of the nose. Sensory tics, like unpleasant focal sensations. Vocal tics, for example, grunting. Patient can voluntarily suppress these tics for a short period of time, but they experience an urge to express them. Treatment includes alpha agonists and neuroleptics. Myoclonus. These are sudden, brief, jerky, arrhythmic muscle twitches. Types are focal, segmental, spontaneous, multifocal, and generalized. Negative myoclonus is where the twitch occurs due to loss of muscle activity. Reversible myoclonus is seen in renal failure and electrolyte imbalance. Essential myoclonus are lightning-like movements. Myoclonus cannot be suppressed. Treatment includes valproic acid and primidone.